Yeah. పర్ఫెక్ట్ అన్న. ఇవాళ నాదే ఎందుకో వస్తలేదు, అది బ్యాక్గ్రౌండ్ సరిగా వస్తలేదు.
That's good.
Yeah. Okay now, Lalesh, shall we start? అన్న ఇంకా 2 minutes ఉంది.
Okay.
ఏంటన్నా సాటర్డే ప్రోగ్రామ్?
Hello, this morning this is meeting unde cardiologist meeting unde India lo TCT ani, so we had like a 1 hour session morning 8 o'clock lesi 8 to 9:15 was that session. So morning lesi udanne oka walk poyechi neighborhood lo 30 minutes, so ready అయిపోయింది. It was a good session. I was actually doing a good job. Hyderabad lo actually Apollo వాళ్ళు చేస్తున్నారు. There are about 3,000 cardiologists are attending the session.
Live
live doing the case. Actually my presentation tarvata there was a live case from Apollo. So TCT ani, it's a big meeting in US, so they're also doing it in India. That was a very good, actually they did a great job. Actually I'm surprised, there are so much the technology, they're using the technology to get the live cases, and they're getting the doctors from here give input about the cases, what they're doing it there. That was amazing.
Oh my God. Okay. నేను కొంతమందితో డాక్టర్లతో కూడా మాట్లాడుతున్నాను. మనం మాట్లాడినట్టు మళ్ళీ మాట్లాడతాం. మీకు కొంతమంది కొన్ని క్వశ్చన్స్ ఉన్నాయి, అన్ని ఉన్నాయి. సో అందరికి ఒక
వాట్సాప్ వెబినార్ సెషన్, ఒక రోజు ఒక వెబినార్ సెషన్ చేస్తే then people will be like a little bit more question answer session చూసుకుంటే it will be easy for them to understand exactly what is going on.
Okay, ఫస్ట్ ఒక వాట్సాప్ గ్రూప్ క్రియేట్ చేయాలంటే ఒక రైట్ పర్సన్ ని పట్టుకోవాలి.
Exactly, right.
పట్టుకుంటా. Yeah. Okay. So Lalesh, it is 9 o'clock. Is that okay?
30 seconds, sir.
30 seconds. Okay.
TV5 కి మర్చిపోయి పంపిస్తాను. వాళ్ళు అంటే నేను రెడీ, TV5 కొంచెం లేట్ పంపిస్తాను.
Okay.
రెడీ చేసుకునేలో ఒక 30
సో సాటిలైట్, ఓకే, TV5 సాటిలైట్ లో కూడా ఇస్తున్నాడు అంటే ఈ మధ్య.
Okay.
కన్సిస్టెంట్ గా చేస్తున్నానా ప్రోగ్రామ్?
చూసాను. It was good. Good topics, good people.
గుడ్ పీపుల్. అసలు అంతా ఐఐటి వాళ్ళు కూడా వస్తున్నారు, వాళ్ళే తీసుకెళ్తున్నారు. ఈ రోజు టుడే దే పుట్ మీ ఇంటూ ఎన్ ఇంక్యుబేటర్, ఎక్స్టర్నల్ ఎవాల్యుయేటర్. అంటే ఇఫ్ సమ్మన్ కమ్స్ విత్ అన్ ఐడియా, వీ హ్యావ్ టు గివ్ అవర్ ఒపీనియన్ టు ఫండ్ ఇట్. వాట్ ఏ ఎక్స్పీరియన్స్ అంటే ఐ కెనాట్ టెల్ యూ, ఐఎమ్ బ్లెస్డ్ అనిపించింది. బికాస్ ఆఫ్ దిస్ ప్రోగ్రామ్ ఐఎమ్ గెటింగ్ ఇంటూ ఎ నెక్స్ట్ లెవెల్ థాట్ ప్రాసెస్, ఎవ్రీథింగ్.
You learn a lot too when you talk to these people. They are at a different level. See, each field they have so much more experience, right? So that just helps quite a bit.
భయమైతుంది మాట్లాడాలంటే కూడా. నేను కూడా హోంవర్క్ చేయాల్సి వస్తుంది, లేకపోతే ఇట్ విల్ బి లైక్ ఇన్సల్టింగ్ వాళ్ళని. సో నైస్, ఇట్ ఈస్ వెరీ నైస్. ఓకే ఓకే. మన ఇద్దరు మేయర్లను తీసుకురావాలని కోరిక. ఐఎమ్ ట్రైంగ్.
విచ్ వన్? అట్లాంటా వన్?
అట్లాంటా మేయర్, హైదరాబాద్ మేయర్. అట్లాంటా మేయర్ ఎవరు తెలుస్తలేరు, బికాజ్ హి ఇస్ డెమోక్రటిక్ కదా.
దట్స్ ద ప్రాబ్లం. షీస్ లాన్స్ బాటమ్, షీస్ రిజైన్డ్, సో షీస్ లీవింగ్, షీస్ టేకింగ్ ఎ జాబ్ ఇన్ షికాగో. సో I think she's not. I mean, we tried to get her to API, so she didn't want to come because she already resigned. I think she said it's not going to be good to just to come in because she already resigned. So she sent a message to us.
Okay.
So that'll be good if you can connect both Hyderabad mayor and Atlanta mayor at the same time.
Yeah, one is Hyderabad mayor and Atlanta mayor, and our sheriff and here DGP are someone. That's in my agenda. I will do that.
That if you want, I can connect you with those. I think I know Sumati Reddy very well, and then DAG Mahendra Reddy was my senior in school.
ఇంకా హ్యాపీ అన్న, అది ఈజీ కనెక్ట్ అయిపోతుంది. DGP ఇక్కడ మన షరీఫ్, కమింగ్ షరీఫ్ కానీ అట్లాంటా షరీఫ్ కానీ ఎవరినో తీసుకురావచ్చు.
in Atlanta Sharif, so that'll be better. Yeah.
Atlanta Sharif touch ana nenu ee
I
Sharif
I can find out. I think Prashant can connect me. Prashant has a lot of contacts there. I can ask Prashant Baigraf.
Oh, okay.
Yeah. Baigraf Prashant has a lot of those people. He works with a lot of people in both commercial and both these kind of functions.
Okay. Ready, Lalesh? Okay, Anna, ready? Telugu, English మాట్లాడదాం.
Yeah, English.
Right.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, go.
Welcome to Mana TV and TV5. You are watching Insight with Praveen Puram live from Atlanta. Today, our esteemed guest is a renowned cardiologist in Gwinnett County, and he is from Georgia, Mr. Srini Gangasani. Good morning, Dr. Srini. Thank you so much for joining this morning instead of your weekend. And quickly, I will introduce you and then we will get into the program. And congratulations for selecting into the board member for Georgia Medicine. And we will get into details shortly. So just to introduce Dr. Srini Gangasani is a practicing cardiologist in Lawrenceville, Georgia for over 2 decades with board certification in cardiovascular disease, echocardiology, nuclear cardiology, heart failure and transplantation. He is the founding partner of cardiovascular group based in Metro Atlanta. He was past president of GAPI, which is Georgia Association of Physicians of Indian Heritage, past board of trustee and vice chair of American Association of Physicians of Indian origin, which is called as API, which is the renowned group of 120,000 physicians in this particular organization. He was the chair of 37th API convention in Atlanta in 2019 and chair of API Global Health Summit in 2019 and 20 in Hyderabad, India, and 39th API convention in Atlanta. He was a past chair of Department of Internal Medicine at Northside Gwinnett Hospital, past board member of Gwinnett Medical Center Foundation, and current director of GAPI Volunteer Clinic, immediate past chair of board of directors. What a historical history you have, Dr. Srini. Again, Dr. Srini is from Kurnool district from the Andhra Pradesh, and welcome to the show, sir. And first of all, we would like to congratulate for selecting in the board of Georgia Medicine by our Honorable Governor Brian Kemp. So we will definitely learn about more on this being in a board member. What is the advantage and what is your journey in selecting this into the board?
Yeah, thank you, Praveen. Thank you for giving me the opportunity to talk to the viewers of Mana TV, TV5. And I think it's nice talking to you, being from Atlanta. So the one correction, I'm from Nagar Kurnool, Mehboob Nagar, old Mehboob Nagar district, but did my medicine in Kurnool Medical College in Kurnool. But thank you for a great introduction. So I think selected to the Georgia Medical Board by Governor Kemp is I'm honored and privileged to be part of the elite members of the Georgia Medical Board. I think part of being Georgia Medical Board, like I was the third person of Indian origin to be on the board in over 150 years of Georgia Composite Medical Board. And also Dr. Subramanya Bhatt also this year joined along with me to be part of the Georgia Medical Board. So Georgia Medical Board is comprised of 16 members. Out of those, 13 are physicians, 3 are other non-physician members. So I think it's great to be part of the team which supervises the licensing of the physicians and a lot of other healthcare workers. But thank you for this opportunity.
Dr. Srini, we are very proud of you. Being from Telangana, I would say you are the first doctor being on the board, and we all are proud of you. And how this happened, how the selection happens, and what is the criteria?
So usually, I think the governor's office looks at all the prominent physicians in the community throughout Georgia, and they shortlist few people referred by other people in the community, And then actually they asked me about 10 years ago, you have any interest in part of being the board? At the time, I was really busy with my practice. I said, I'm really young and I'm really busy with the practice. I think I'll just take some time. And again, 3 years ago, one of the somebody from the governor's office called me 3 years ago. I said, do you have any interest? I said, if there is an opening, definitely I will consider it now. Now that I have a little bit more time, I'm done with my board of trustees of API and then GAPI, and then just running the GAPI volunteer clinic. I said, okay, I think it's nice opportunity if selected, because it's also not only being selected by the governor's office, but also need to be approved by the Senate of Georgia. So I think it's a really very privileged and honor to be part of this, the board.
I'm sure, definitely, with all the volunteer work you do, you deserve this position. And tell us more about, are there any committees you are going to work in this board? And what will be the advantage being for the in the Indian origin, how it helps the Indian community?
So Georgia Medical Board is the licensing agency for physicians and a lot of other healthcare professionals like physician assistants and the respiratory care professionals. So board has a responsibility of investigating any complaints against the physicians. And also it disciplines if there is any violation of the Medical Practice Act. So basically we are like a watchdogs for licensed physicians and the other healthcare workers, make sure that they're following the rules and regulations of the Medical Practitioners Act, and also the other laws governing the professional behavior of its licensed physicians. So I think basically there are 4 main committees we look at. So licensing committee, which helps with selecting the people when they apply to practice in Georgia. We want to make sure that he or she is a right fit to practice with all the credentials, what the Medical Practice Act says. The second one is the investigative committee, when there is a reporting of the disciplinary action need to be taken. So we go through that. And there is a wellness committee, which looks at make sure that everything is going correctly. And there is a rules committee, which looks at if with the changing times, like, COVID pandemic happened, and telehealth is a lot more now than what it was even like a year and a half, 2 years ago. So we can make the rules a little bit different so that it'll be easier for the practitioners to go into the practice and help the patients, especially in Georgia, to provide a quality care. That's basically mission of the Georgia Composite Medical Board is through proper licensing of the physicians to make good care, quality care to the Georgian population.
Excellent. I think we wish you best of luck in your endeavor. And I don't know how long is this. It is a 2 years or 1 year in the board. We wish you make more rules which are really effective to the citizens of USA and also the NRIs as well.
Yeah, thank you. It's a 4-year term. It's a 4-year term. So I think one thing I can say from an Indian physician point of view, because as a foreign medical graduate, we have a different set of problems than compared to our local doctors. So I think nice to have our perspective in the board rather than having all the local physicians. I think that's where it helps for the foreign medical graduates like me, so that we can give our input so that the rules can be changed to make the life easier and more for the better care of the patients and the physicians, so that they can do their job without having all these headaches.
Great, Dr. Srini. We wish you learn more and also influence our Telangana government to be as well. Whatever we learn, we can also implement in our home country. That's awesome. And you were discussing in our conversation, you talked about the telehealth. I know that the telehealth was very difficult before COVID, but after COVID, can you help us understand, are there any changes in the telehealth area?
Telehealth, before the COVID pandemic, I rarely ever used to see a patient by telehealth. So in March last year, when we started to see less and less patients in the office because of the concerns, they are fearful about coming to the hospital because we didn't know what the pandemic was, where they're going and how it spread, is the treatment available or not. So even in our office, our volumes have started to go down and people were getting sicker, but they're not coming to the office and they are scared to go to the hospital. So they didn't know what to do. Even sometimes even the minor adjustment of the medications, we could save them to go to the hospital. So that's when we started doing the more telehealth, even though telehealth has been there probably like 15 years, but we were not in real time. So if without the pandemic, where telemedicine would have been 10 years down the road, I think we are there already. Just because we fast-tracked the telehealth webinars, just teaching, as well as the learning and seeing the patients. All went up so much. And just RP itself done over 100 webinars in the last 1 year, 1.5 years to educate people, because now we cannot go to the conventions and conferences as much as what we wanted to go. So with these webinars, we learned a lot from, especially from a COVID point of view, because it was ever changing. COVID, what it was in last year, March, versus where we are now with the treatment point of view, diagnosis point of view, there is so much more different. So it was a great experience to go through webinars and the telehealth and able to see the patients from their home. I'm sitting at home and seeing the patients and adjusting their medication so that they don't need to go to the hospital. I think telehealth has been a wonderful tool, and I don't think telehealth is going anywhere. I think we will be able to use this, what the experience we have over the last 18 months or so, go forward and use this for taking care of the patients anywhere in the world. Look at this way. So you may be in Hyderabad, I may be in Atlanta, somebody else may be in UK. So we can connect through a consultation and the same platform, and we can give our input to the patients, and the doctors can get the treatment done with a multi-modality kind of a treatment, so that ultimately the goal is to get the best treatment for the patient.
Absolutely. COVID has changed everyone's world. We all need to really agree that, the technology has improved. The way we live, the standards have been different. So tell us more about in your cardiology, right? If you come to your cardiology, from the business standpoint, do you have an impact being in the cardiology, this COVID, especially if you see in COVID, everyone are trying to be healthier. So from that perspective, how do you feel about your business? Is it down or up?
So these both, I think initially it was down because people were not coming to the office, even though they were having issues. Normally, if you get chest pain, you may run to the office and say, hey, do an EKG, do a stress test. Now with the COVID, and especially in the earlier part of last year, people didn't want to take a chance because chest pain, they can wait. And we used to see a lot more sicker patients coming into the hospital at the time because they were waiting until the time comes where they can't take it anymore. That's when they start to come to the hospital. So that's where the change was. I think we're seeing more patients in the hospital, more sicker patients earlier. Now people feel comfortable, especially the vaccination is a game changer. I think the vaccination decreased the severity of the disease, severity of the hospitalizations. 90% of the people who are being admitted to the hospital, especially with the new wave, are unvaccinated patients. So I think if there's one thing I can tell anybody, I think please get the vaccination. If you did not get the vaccination, get the vaccination. Everything is going to have some risk involved, but the risk versus the benefit is huge compared to the risk involved with the vaccination.
Excellent, Dr. Srini. You have rightly said everyone have to get vaccinated. As Dr. Srini said, please, if you didn't, go to your nearest clinic and get the vaccinated done. And before we touch upon more on the cardiology, I would like to touch few things which are really used to the NRI community. One is API and GAPI. So tell us more about how you have been involved in GAPI and API. And you recently just said that GAPI clinic, how it is helpful for our NRI community.
So API and GAPI are one is a national association, GAPI is our local association with the Georgia Association of Physicians of Indian Heritage. So initially I was more involved with GAPI as a being member of the Atlanta local community. And eventually I got elected as a president of GAPI in 2010. At the time, we did not have any resource to go to if there is a parent visiting from India, if they run out of the medications, or if their blood pressure is running high, or if they're having chest pain. We didn't have it. We used to do health fairs at the time under the guidance of Dr. Sujata Reddy over at the temples or in one of the community halls once every 3 to 4 months. So that was useful, but not on a periodic basis. So we wanted to have a specific structure where volunteer physicians can come in and help these uninsured or underinsured patients who are coming visiting from outside the country, like India, or also locally, some people who don't have insurance. So for those people, especially taking care of their chronic diseases like hypertension, diabetes. So now the medications are very cheap, or some of them are free through some of those pharmacies. So just consultation was a problem for them because they couldn't go to the doctor. They couldn't get a prescription. Without a prescription, you cannot get the medication. So that's when in 2010, along with our GAPI committee, we decided to open up a clinic in GAPI in Norcross in the Global Mall in Atlanta. It's been running twice a month right now, every first and third Saturday of each month from 1 o'clock to 4 o'clock. So usually we see about 15 to 20 patients before the COVID pandemic came. We shut down for a little while until we knew what was going on. And now we're doing, again, open. Some part of it is telehealth. The people call the clinic at the time so that we can take care of it. Our goal is mainly to provide taking care of these visiting parents, visiting families, and the uninsured people. So that's one. And from an API point of view, API has done a wonderful job in the last 1 year under the presidency of Dr. Sudhakar Janalagadda. With one email, GAPI and API together collected a lot of money. GAPI collected close to $70,000 and API collected $5 million in a span of 3 weeks to provide services to oxygen generators, oxygen concentrators in India. So they've distributed pretty much every state and with most of the district hospitals, including in Telangana, as well as Andhra Pradesh. So that was a huge help, especially when people were suffering. And then the third thing GAPI and API did was they wanted a telehealth platform to provide a counseling service to people who are in a quarantine. So these people, when they're at home, they're diseased, they're quarantined and they get nervous, anxious. They don't know what's going on, when to go to the hospital. And they were flooding the hospitals because of the concerned anxiety. So API asked if anybody can do anything with the telehealth. So we had an eGlobal Doctors platform at the time. We were going commercial. We were doing the beta testing at the time. This was started by like 5 doctors and 2 IT professionals. And then when API was looking for a partner, so we partnered up with API and the Seva International, which has done a wonderful job coming together 3 of the groups and had a counseling session every night from 8 o'clock until 1 o'clock. It just to talk to the doctors, to the patients, and then just to take the anxiety off and also educate them when to go to the hospital. What are the things you need to look for? So those are the kind of things helped. And in the last 3 months, we have seen through eGlobal Doctors over 2,300 patients. I think it was an amazing experience to get 250 physicians signed up in a week time to the eGlobal Doctors to do the volunteer service. It was really very grateful for all the volunteer physicians who came forward and helped, including physicians from API and Seva International.
Hats off, Dr. Srini, for all the efforts. And I personally was there when you all have sent the oxygen concentrators via UPS. And really, it's great. It's great because you all being the front warriors and signing up for helping India during the tough times is really a great effort. And to all the NRI friends, as Dr. Srini said, there is a GAPI clinic in the Norcross and Global Mall. Every first and third Saturday, please, if your parents have any small issues, all our doctors are there to help. Even though you are not insured, you can go and take suggestions. And if it is a minor one, we can definitely get it done. Don't delay. And the other thing, eGlobal. This was my dream, Dr. Srini. I remember I came to you and said, Anna, we'll create a WhatsApp group for everything because people are suffering if they have anything. And at that time, you told me that there are a lot of legal issues where we have to work through. And now this COVID has cleared all of them. And I'm very happy. And this will also open up for all the different global positions if they want to take a second opinion. Even from India, if you wanted, people have a perception that when we take an opinion from US doctors, that would be good. So this will definitely, globalize that. And I'm sure that eGlobal will be a great platform for all of us. And tell us more where the viewers, the NRI friends can go, or the Indian friends, if they want to have a medication online, where they have to go.
So eGlobal Doctors is a connecting e-health platform to connect the doctors from anywhere to the patients anywhere. So there are still some obstacles we are working on. So from India, during this telehealth, we had a lot of meetings with the Prime Minister's office. To get the licensure is still a little issue. So we are working on with the governments, both Telangana as well as in the central government in India, to get those obstacles cleared out so that's easier. So, but for secondary consultation, it's easy. So people, when they have the issue, somebody has a blockage. So as a cardiologist, I get calls every week with the angiograms and the echocardiograms. Can you look at this film? And can you look at my echo and give me the opinion, what you think? But because somebody knows me, they're sending me, but there are a lot of people out there who want a second opinion. No, they just want to make sure that what the treatment they're getting is the right thing. And so this is a great platform to connect the doctors and with the patients to get a second opinion, just to make sure that they're getting the right treatment. So the second way it helps is, as you know, all our families are back home. If one of my family member has the problem, if they want to get an opinion, I cannot be there with the doctor at the time. So my mom was sick last year with some kidney problems, and I had to call the doctor later on, and sometimes they pick up the phone, sometimes they don't pick up the phone. So it was not that easy, that I felt bad not being there just to directly get the information. So with the eGlobal Doctors kind of a platform, we can connect. So patients can be there, family can be there from anywhere. Patient can be in India, doctor can be in US or UK or even in India, and also the family may be in Australia or New Zealand. All of them join together so we can get the plan of the action at the same time so that everybody is on the same page. The third advantage of having the eGlobal Doctors kind of a platform is, for example, in cardiology, there are sometimes you need more specialists to get the right decision. Same thing with the oncology or the cancer. When somebody has a cancer, you don't know whether you have surgery or radiation. So the same way, we can have a multiple specialists come on board at the same time, listen to the patient, talk to the other doctors, and we can do the consultation at the same time. So they can have a multifaceted kind of a consultation at the same time so that we can provide the best care for that one particular patient. For example, in cardiology, if somebody has a weak heart muscle, as a heart failure specialist, I want to take care of the medicines, make sure that they're okay. If there is a blockage, if they need a bypass surgery, we can have a surgeon on board. And if there is a electrophysiologist who needs a defibrillator placement, so we can all be at the same time, be there and get the correct treatment for that patient. So those are kind of a 2 or 3 kind of advantages of having a telehealth through the eGlobal Doctors. And it's a vice versa too. Like if somebody wants to go from here to Hyderabad to get a knee surgery done, we can connect the same way. So some patient who is a self-employed or self-pay, who doesn't have an insurance, want to go back to India to get a treatment for their knee joint, knee replacement is a lot cheaper, and we can arrange for the right kind of a doctor for that particular treatment to be taken care of. So it's both ways. I think it helps to connect the doctors and the patients. That is the main goal of the eGlobal Doctors. They can go to the eGlobalDoctors.com and register themselves, and both as a patients or the physicians if they want to be part of the eGlobal family.
Excellent. What a platform is this. I think it will enable everyone to be safer and peaceful, especially when you are going to an unknown doctor. People want peace, whether I'm going in a right direction or not. I think this will be a right platform. It helps everyone with a just connect. If you have an internet, we can make it happen. So excellent, Dr. Srini. Let's touch upon a little bit on COVID, and then we'll go to the heart, your core subject, where we can get some information how to take care of ourselves. So during this COVID, once the vaccination is done, we are hearing most of the people who are undergoing COVID, whatever the 14 days, they are undergoing with steroids. So most of the people, we hear that they are having death because of the heart attack. So what is that you think the patients need to be careful if they are already a heart patient?
So there are multiple, the COVID is a new disease over the last 1.5 years. We've been learning each month and month. So what we know now may not be the same 2 weeks from now or 3 weeks from now. So it changed quite a bit. So the few things from a COVID and a cardiology. So heart patients who are already have either blockages or a congestive heart failure, or even with the diabetes and bronchial asthma, so they have a limited reserve. So when they get the infection, they get the symptoms a little bit earlier, and they can get the severity of the infection maybe a little bit more than a healthy person. So definitely they need to be more concerned not to get the disease even if they're vaccinated. So it will be a little bit more. So whenever people get the COVID-19 infection, about 40% of the people seem to have a little bit of a weakness of the heart muscle, which can make them more prone to develop the arrhythmias and the congestive heart failure. Luckily for majority of the people, it's self-limiting. It gets better by itself. So we don't need to worry about it. So it just sometimes a smaller number of people, they can get a little bit more tired, short of breath after, and they may need to have some testing done later on. But majority of the people seem to have improved themselves without having any specific treatment. The third thing is the blockages or the blood clots. I think one thing with the COVID is is a hypercoagulable state. What that means is blood clots a lot easier when somebody is infected with a COVID. So the blood clots are happening both in the heart as well as in the lung arteries. So when you get a lung artery gets the blood clot, it's called PE or pulmonary embolism. That also causes a sudden death. And when the same thing happens in the heart artery, it's a heart attack. If the same thing happens in the brain artery, it's a stroke. So any of these arteries can be clogged up, especially somebody who is really sick and somebody who has a D-dimer levels are way elevated. So those are the people we are treating with the blood thinners so that we can decrease the chance of that happening. Especially somebody who is sick and not moving around, they can form a blood clots in the legs. So I think it's very important to move around and do the breathing exercises and be on the blood thinners. And if there is a shortness of breath, if there's a chest pain, they should be checked out so that they're not in one of those three things are not causing the problem because of the COVID-19 infection.
Great. Thank you, Dr. Srini. We also hear some things like Covaxin, Covishield, and in US too, if you see Pfizer and Moderna. So can you, from your experience, tell that any particular vaccine is affected to blood clots? Is there anything like that the people need to consider?
I don't think there is any one vaccine is more prone to develop the blood clots than others. So the majority of the people recommend that the best vaccine is the first vaccine you can get to. Okay, all of them have a little bit of a different sensitivity, specificity, efficiency, but if you can get to whatever the vaccine you can get, personally, I don't mind getting any of the present vaccines out there. There is a small percentage of the people had some myocarditis, especially in younger, I think the teenagers and the younger people have a little bit of a higher risk of having some myocardial inflammation. But as I said, this is majority of the time is self-limiting. So I don't think you need to worry about a small risk of, if there's a 1 in 10,000 risk of a side effect versus if it helps you 25 to 30%, I would rather take it. Just simple example, Praveen, if you're going on a highway, there's always a small chance that somebody can come and hit us, right? So, but we still go because we cannot just look at it. We do our defensive driving and make sure that we are not playing on the phone and we are not drunk so that we can have a decreased chance of having an accident. But it's always a small chance. But for that, you cannot stop going on a highway. So the same way, I think personally, there's a small risk, but the benefit outweighs the risk. So I think everybody should get the vaccine. That is the only way we can get rid of this pandemic and we can have our normal lives together by getting the vaccine.
Absolutely, you are right. I think we need to definitely go with the vaccine, and because of the research done on it, and to be safe, it is always good to take. And the last thing would be on the COVID. We are getting ready for a third wave or fourth wave, and especially children are getting affected. That's what the news really scared everyone. So what is your thought process? Would it be the Delta plus, or the fourth wave is going to come?
I think this is a long-term thing. I think my feeling is at least we're going to deal with this at least for next 1 year because we still don't know. There are so many new strains are coming. So each strain has a different kind of a characteristics. As you know, Delta is more infective. It may not be more virulent, but it's more infective. So once one person gets in the home, I think pretty much everybody seems to be getting it. So I think the vaccine is the answer. I think with the fourth wave comes, but as the people get more and more vaccinated and get more on herd immunity develops, I think once you get to 80% of the herd immunity, either through the vaccination or the infection, I think that's when I think we'll be safe. But until people get vaccinated to that level, we're going to have a groups of patients and groups of regions going to be affected. And hopefully there is no bad strain comes, which is more virulent. Luckily, so far, the virulence has not gone up. So severity of the disease is not that much. And with the treatments available, we are saving a lot more people right now, even in the hospital, compared to what I used to see 6 months ago, 8 months ago. Now people are not even going to the ICU, not even going into the ventilators as much as before. Because some of them are vaccinated people also getting the disease, but they are very mild. So the vaccine does not prevent the infection. It decreases the severity of the infection and decreases the disease severity. So getting the vaccine, but they can still have this minor infection. I would rather have 2 or 3 days of little cold and cough so that I can go on with my life rather than being in the hospital and being sicker and then increases the mortality.
Excellent. I think you have very well said that the vaccination has really brought down the ICU cases and everyone are operational right now. So we hope that the fourth wave doesn't come, and the Delta and Delta plus, it will not turn to Beta or Zeta, etc. With that said, thank you so much for all the information what you have given, and especially on the cardiology. So if you see, Indian community, especially the Asian community, are prone to heart attacks. So what is your 2 cents to everyone to take care of themselves?
That's a great question. That is my passion about the cardiology, especially in Indian Americans and people in India, not only in India, Southeast Asia. All of us are 3 to 5 times more prone to develop the heart disease, especially the blockages, compared to the white Americans. So I think that is way high. That is, some part of it is genetic, some part of it we cannot change it, but I think we can change the diabetes. I think diabetes is very prevalent in Indian community and Southeast Asian community. I think you take care of the diabetes, hypertension, high cholesterol, not to smoke, exercise regularly. So especially if somebody has a family history of the heart disease, especially at a young age, get it checked. If anybody gets the tightness, pressure, heaviness, and going into the arms or going into the jaw, especially happening with exertional activities, please go and get it checked. I think it's easier nowadays. It's not, procedures are very simple to fix it and decreases the morbidity and mortality. I think the one thing with the Indian population is, I think a lot of people have this myth that my stress test was normal, my risk of heart attack is 0 or low. It's not true. More than 50% of the time, blockages which cause the heart attacks are less than 50%. So the plaque ruptures and forms a blood clot. Blood clot makes it 100% within 5 to 10 minutes, which can cause the sudden death, which is 5 times more happens in Indian or Southeast Asians, especially younger people. That's why we're seeing younger and younger people. I see 20s and 30s and 40s people every week, Indian Americans coming in with a multivessel disease. What we have, what we call a malignant heart disease, which means it's like a cancer of the heart disease compared with all other communities versus Indian community. We are so prevalent to have so much heart disease. So take care of the risk factors, get it checked sooner. The calcium score helps to identify the plaque early. Stress testing helps to identify the plaque which is more than 70%, and get it treated, and take the aspirin, take the cholesterol medications if you need it, take care of your hypertension, take care of your diabetes. That improves the quality of life for us to live into 80s and 90s.
Oh my God. It is a scary situation for all Indians. So I think we all need to be very, very careful. So tell us more about the immediate actions, like the CPR test everyone undergoes, right? So most of them might not undergo. So especially in US, if people are there, what is your suggestion to take that CPR test? How that it helps?
So CPR is helpful when somebody has a cardiac arrest. So nice to know what to do in a situation while you're waiting for the EMS to arrive and take care of it. So majority of the time it's a ventricular tachycardia or fibrillation. Heart goes into fast kind of rhythm. Heart is not pumping the blood to the brain. So the brain starts to die in about 5 to 10 minutes. So we have a narrow window of 5 to 10 minutes to save the brain. So when you start the CPR, doing the chest compressions about the 30 times with some breathing in between, or even if you cannot give the breath, at least do the chest compression so that you're trying to push the heart to keep the brain alive while you're waiting for the EMS to come and help. And if somebody is in ventricular fibrillation, if you have an AED available close by, get the AED, check it out. Fibrillation comes out really fast. And then if you call the EMS so that they can come by and help. But the CPR, everybody in the family should know, so that either your family member or a bystander, if you know that they're in a situation of cardiac arrest, doing the CPR prolongs how long you can keep the brain going while trying to get the help. And sometimes they can come back by themselves and then they're great. If they wake up, great. You don't need to do the CPR, but you're saving the brain tissue until you get the help.
Awesome. I think that's a great lesson what you have explained us, and I'm sure that everyone will be benefited out of this. Dr. Srini, in the interest of time, we are almost at the end of the 30 minutes. I would like to tell your final words to all the viewers from the cardiology and also the COVID and also the achievements what you have done, so that we can conclude the meeting.
I think the cardiology is an ever-changing subject, especially in COVID pandemic. I think just be aware of what is going on out there and just take care of yourself. with prevention is better than cure. So I think the one thing I think especially Indian community do it is get regular physicals from the physicians, then change your risk factors, avoid smoking, avoid the lack of exercise, obesity, diet. Our diet is not so well, but I think you just try to eat the salads, fruits, vegetables more so than the red meats. So I think just the risk factor modification is the key. Do whatever you do it in moderation. But if you do get the symptoms of chest pain or shortness of breath, especially with exertional activities, please go see the doctor so that you can get treated. Treatment is easy. Treatment is very pain-free right now. I think we can do the angiogram within 15 to 20 minutes, and there is a blockage, fix it. People are awake, alert, and go home the same day, sometime next day. So, but I think take care of yourself, take care of your risk factors, especially if you have family history. Take care of yourself. I hope Indian community learns from our experiences and be better citizens so that we can take care of our heart, so that we can give it back to the community.
Thank you. Thank you very much again for your time. And congratulations on your new role in the Georgia Medical Board. And we wish you all the best, Dr. Srini. And we wish you to go in your levels and also serve the Indian community and also the US very well. And again, thank you so much for your time, and have a great weekend.
Yeah, thank you, Praveen. Thank you, Mana TV and TV5 for this opportunity. Appreciate it.
Bye.